When a pair of twins share a single monochorionic placenta, there's always a bit of variation in their size. And in fact, up to 20% difference is considered normal. Once there's more than a 20% difference in size, though, they're called discordant. And the situation is usually that one twin is normally grown and the other twin is smaller relative to the normally grown twin. Their difference in size can be most accurately predicted from where the umbilical cords are inserting into the placenta. If they both have a central cord insertion, you expect the twins to share the placenta relatively well, and twins with a very different cord insertion, like one that's central and the other at the margin, or even one that inserts into the amniotic sac and then travels to the placenta, which is called velamentous, those kinds of cord insertions would be concerning and important to follow for growth. When the smaller twin is struggling and not quite getting enough of what it needs from the placenta, we might see that its amniotic fluid volume is low. Sometimes this situation of normal fluid in the normally grown twin and low fluid in the smaller twin is mistaken for TTTS, but it is not an issue of transfusion. This is an issue of how the placenta is being shared. The first twin has a normal amount of placenta available to it, but the other twin has a fixed small share, and as it grows and needs more, it doesn't have much more available to it. Treating this as twin-to-twin transfusion and lasering the connections between such twins is not the answer and not the right treatment. In fact, it could be quite harmful to the smaller twin because it disconnects the sometimes even helpful connections. The key to a diagnosis of unequal placental sharing is to avoid any operative risk if possible. Since laser is not the right treatment, the key is to get these fetuses as far in pregnancy as possible using ultrasound for surveillance, weight, fluid, and measuring the umbilical blood flow and other blood flow with ultrasound Doppler. These twins usually have an AA connection, which is protective and keeps them from developing twin-to-twin transfusion syndrome. Their issue remains one just of growth. As you enter your third trimester, non-stress tests are added to the surveillance protocol. Using all the tools in our armamentarium for surveillance, in our experience, otherwise healthy twins with unequal sharing of the placenta have an average age of delivery between 33 and 34 weeks, which would be considered quite a good outcome, and certainly allows you to avoid adding the additional risk to the pregnancy of an invasive procedure such as laser.